As coronavirus cases continue to climb, a disturbing trend in already hard-hit areas may be headed our way. African Americans are bearing the brunt of the pandemic. An analysis by the Associated Press shows that African Americans account for 1/3 of all COVID-19 deaths in places where that data is kept and published. Federal officials have taken notice.
We're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications.
And we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible.
So what is happening here in Hampton Roads, where the population of African Americans is higher than average? 10 of your side's Lex Gray has spent weeks looking into this, and she found it does not look good for our area.
That's right, and that's because there's just not enough solid data, not on the federal, state, or local level. But what we do know is reason enough for concern.
We try to wrestle through this crisis, but also come up with afterwards cures and vaccinations. It's really important to see how the disease hits different demographic groups.
Virginia Senator Mark Warner joined with other Democrats, including Senator Tim Kaine, to introduce a bill that would require federal health agencies to collect and report racial and other data on the pandemic. Most legislation is stalled right now since Congress is not due back in Washington until early May. But Warner says initial reaction to the bill indicates that it could get bipartisan support.
I've raised this in calls with the administration, and they've indicated they thought it was important to have data as well. I think the administration wants to work with this. I hope. Who would not want to have this appropriate data?
But gathering data doesn't do anything to stop a problem that may already be barreling straight toward Hampton Roads.
The logic used to be that pandemics would be the great equalizer, but it's not. What it's done, it has unveiled the disparities in healthcare.
That's Dr. L.D. Britt, chair of surgery at EVMS and a public health expert. He says African Americans are already disproportionately affected by health problems that can make a coronavirus diagnosis even worse.
It attacked really the weakest link. People who don't have the capital, people who let's have comorbid factors, they have illness and they have other disabilities, and so they have a higher mortality rate.
The best strategy for short term, Britt says, is to socially distance as much as possible. Longer term will take bigger change.
This is a wake-up call. It took the veil off. What we used to think that we had the greatest healthcare system. Yes, we have the greatest healthcare system, but not for the full population. And that's what this to me has. That's the message that I've gotten from this.
Virginia does track cases by race, but there are limitations. You can read more about that on WAVY.com. I'm Lex Gray, 10 on your side.